Yat Shikado Shidine, Shady Kodo, Profilia Faller, the Shijanido, my Dishkish Inchla, Todicini, Bashichin, Adot Ashit, the Shinado Tapa, the Shiche. Kodo Eya, here, Kojahana, that's your Gize, Kodo, Nihitchana, and Nane, don't hit Quadi ban by Yatan Tiki, Ben his not a wheel net or lesh, Edo Shidne. Send Lini Ecuador to the Zinlini be Anil in Kokodoshi to the Zimbe Ashlet or less. Ado art are in hit to the Zinda Hollondo, Kodoshi Yada ni Kodohojon or less, Nahastan Chama Yadil Hill. Ado Jona A. H H1. Ado Yahon Ziltan Lini Hon Todan Lini Art Hon. Nikiran has algo con de yat hon hil nahot at ole hon. DJ con ni yajene away ni blon ecuador hon ni na dealsin a kuj ecuador ni te dealsin le. Kodo nas go net ni con he la hon. Nas lon con juno ya hon. Nihina de yel katole, don nihen na dache, ba he nitzen, Chaman Hassan, Yadil. Kodo nas go net nij, yat on hil nahuido a. Konta nihino rano, nihitonas kangon hiwaneshkishnas kan hi konta del kleo. Nihiteske nas ango ado kon hikeya. Dan ade dahana ade hot a ya kon, yat on nane dado lel. Ado bet ado yi dali kon ni man hije. Bet reje da danle ado kon ni masane ni che ni nale. Hashine la go kebe da kehi a kon yat on hil na hot atole. Ni ket aton len hitit aj yat on hon nane dadole ni hit istra ya na hot etole. De quina khaye de quiz kanye da she kwa. The questo jo ba e kon han snein le hon. E he lan kon is it bahas le inki. Ado hashine lan e kon hit in en lini hit a na hastan kat the hon. Beke the hastin le hon. Hashine lan hit in en lini kon beje dusted. Ado hashine lan kon. Bekat chana nidle. Ado Yat eko ekon niheje betske name gladole. Hana inil nidole. Yat eko kone nijehon nihina de yes katole. And jono kon nitan lini kon. Yat eko kon iskahon nahon shondole. Ado hashil to kon hidden end lini till cage case twisani. Is el Edenas dan yat das den Jonon hitches kedole. Betranda hon kasole, Shamana Hasania de Lini hon. She in near so there's an ill in that nihit so there's an enahilatole, nihit so there's an art and nakatadi dole. The honsen that dan lehon, yat echo nakatadi dole. The konacha archin dan lini, yat ehon nada kedole. Dan tsade ashlatim belkhahotzon lidi khashinson khachina o yu andakhe otka ike de ka nanish ike de ka ashin sagonanish bi yisin belek etahinla njono ye etat edole naskone nije el khan nahisi khedole don jono kenda hidi ni dole naskone nije ada kon hinat an lini artso nakhabel wan lo dole naskone nije the quiz can she hon calls that you're not a bit ilni, Jono con hit in there, you're not ho atole, you're not take questole, Ado contilla de not ani than lini nahadil nishit and lini talada than lini gonna hassan bakatni dani, nikinanish the holoni do aho want to see dani nanish de see funny benashni dole, an lechin nahol aj atoichi, as twisani than lini Nkitra ya na da hot etole, koni hit istra ya hot nin gladole, Shamana Hassan lini adeshi. Konsago etolizan an shende, behanana sit ole, do behana inil need ole, nasko net neje. be shohna ni zi o le hon be nasko net ni be ya ehi do yo on ni ya ehi be khantna de keso le hota e to de zimbe hanana si o le ati de be ni chojona sling achen yan kinat an linin kon ni hanana si o le Honorable President Jonathan Nez.
Oh, yeah, Deja, sister, kdo tlzinha behin zi, ro ishi be, nihit zil do leftiche, do jadi nana khagi 2021 biye. So tlashin e ya kon yik eni hidna, jenda hasti. دور لأكون كأني هنا لا دا جدا دينشي يج نقول ده ندشني دا ينحلنا أكون دي أني نانا خاجيشي إيا بي لانا وينز دي دكوسن سكاجي ناس إيزاد دا نحلنيجي ناتش كودوني تدي نو tot så dilsen skeda shudna so ihe kodo ya ihe do jona goshi ihe nache ado kon banda hilna de kwishi e kon ihe keni hina beda dol nagi jo ado ihe keni hina daja denigi ya kon ihe keni hina bat so dilsen budget op in het tastel. Kontsudzen bij haut zi ishi kudo bedalni do je tsudzen do halont binda shi kudo tsudolzen ni enige napa ado an hieta tsudolzen nat ani da zel endan lenigi da ik enige na Tlashin e ya lana da nitsin a schode ni eni hidna da istrat o lel da hat no shi dot so dilzen oda a ko de kont konsentragi le ya ich ni da ya kada alla nacha le e probie da do di gije da tol nagi e na din tra de miliage ado na hast e nez na din do ba antes din do ba ant alla e konella e konik enig na bida dolna ndishni yashkeroshna le la da ne ni enig na do de nadan den hi belashlai de konsentragi na hast aids atta netol na heda betol na din atta je dolle beach is do galot at latan fashi o anita yat enda sling nak atta de milia joba anak nes na din doba an lat atta anelt o ikoni keni hidna each daskri akonde sai andi edan andi shits isbich nahoti di atta jizlink oba lak adaz nakitra da dinda ndezid andi oyo cheta tzi dobits isbich da hasti edo bedashni Ladan ninigi ya tashi o ani ista betziligi do aninda kregi shi ya behzini ya ichdo galota akonde ni massa ni cheni nala nasta zlengi bansadak kesa shone kompesa ni kodalia Washington da large da sadagi aje not ani lenigi shi edo aje not ani Ye haganji do de haganji yela dasli beso at de shladin haut zojik lashla ibiche kodalia ako de kuishi jenzli o khani gyun le tloko de khe nda ilni khuje troche na joje da kinsan ojik ze na liaba wandaz nela o khani gyu ad de khe no bada hanna shikero shinna ako di bitsa date ne ashon ya des kitten lego e sahandetle ado ad peshinkl de khe ad so di do itini chosto itini do bazanda heida kompetol nagin lego tada ga yalti oda di ze do bechito bikasti oda di yida del nahodan lego do jo بدال جو دو clean dal ingo with the dol na hota e binina e da hosnya ta di na to e o ta di nida so kon kha ta ni tsna binina e kon a kwich kanen hi je kon dele na ki jinda national di jinda national se bines na tindo ba ana dina kenelt e kon hi keni na di nasnegi bitsado adajite se bi nes na tindo ba ana dina ke nelta to shi jinidand khodoye ban sada kes di to kosentraginast eits atta ni konash ni hota la konigi enige na trada da kaho o da no da hanne ni je gonda yele aye ni kon ik enige na nelta konelta sebine zadino ma na dinaki kon keidan lenigi bijeda ben das de shida wat sadil zendale naso Adosh Tishnit Konla Yichadaskri Ayat Endas Lane Nakitsat that the Melia Judova on Nakinez Neznatin Dova Anshatsata Kudova and the Hilne Adokon ze Bazlin E Kon Zel Endan Lenigidon Ni Halchini Edan Lenigin Hika Nachagi jo e kon de kosentragi bedadol nagi ya ilindal nash ikan da jagi e iltsabada dots tadi no got nal sos nije kodali ya Washington da jo e zel en khada halyadon hikeda dez e binina e iltsadol le hadoni e kadel tsko jo abedan zinigi che o sha dots dan zinigi e la Kodalia. Clascedo Tadan, e abbe basla. Aro cadeia ti the mo na aro na the mo gido. E ya ti con ik enigidna. Bada hayanigi ya le hagan has ad. Bits is da has tigi. High risk nigi CHR ikeda des igi do azel injeda edo ik enigidna shot dot sitan zinigi eba hot ikat di the mo bi judik at the mo biskan na kijido tragijido dinjido lenda inische Eishik adi sieg shardan linigi nakhalchin dal nishjin lego tada da krak ni ken hidna keda hat ego ada shi e kun zel en bada hayaj ni ke kad bada atse sa ya hasthatin do ba ashla bendacha di ya do edo hot ya which kodol nil eshik di satsata yos kasona e kon zel energy ya hot baho ahtole so ni masani ki chain nala jo e kodoba adol nil di no hot ya sa ni kodalia la sheets la so dan linigi Hastran die dobe ashla dobe la bendache do kuje trali dan lenigida ado halne dan lenigi jo hastran die dobe ashla dobe la bendache egi ya bada dotse dan zenigi jo at baho te o an $1,000 zel enshi ya bijahada dolne Ako dinten da neshona ya Ishin di kon zel in das neligi na tani dan lingi ya baho ahtole don hija ashana de letole should need not the more bis kanagone Slatzata yos kalone akona shi ya baho ahtole hastrantin do ashla do la bendacha hegi so ni keni nashi bilta hosna ashkhode aro dido tsla dan linigia aro dido zel inje bi kon bicenda az degi tada de yegi tada de yegi bis do shi bice kodal netole بعد أتسشين دولة لكن أيضا بعد أست هوني كأني هدنا قال شنا أجند على شيء جو داشن نجي يا first responders داشن صلاة كجدو firefighters دان لنجي يا ambulance Gido ido kon zel ins has agent ya mikida des ingi jo sadole belinagi jodi nasnegi shin le de kwishin des do andi shin kon nasni dole ze bahazlind doi at bada dot setan di blashlai shlatin ha hot zogo so ashil chide nelt ashin hije konal idoleti zegi ebini nadi kon zel endan lengi elsa dole ado tis ba hayaje zel endan lengi kon hikeni nek da des ingi edo ado hastkhandi do ba ashla dobla benda khaygi edo ado shi bada ultra agido Ado hot Asian kodoni hije ashtani ileto le den lenigi Dr. Jill Jim. Let's go hadasi zi okshin kodoni hije ashtani ileto le kodi Washington de sad ni hije kolyagi jo ben nache hot ada ilia do o an hije hot da ilne da di nida sun lede ni je kodalyagi ben nache hot Ina nishidil neto le shigero shidna. Ado dahanne. Dido person hije kodal ya la. Ha she person hije kodal ne ha no da yadatke. So shida. So behaz ani. Bella azli peso hot achudo inha no. Tlae nike masan chain ala no lenigi chuchuta hofna. Ke la da do no. Besh chi shije kolya. خدا شجع كليا bathroom edition دا شادا ليا دا نودا الشيء دا نو ديدو biyadil tskegi. Ya da tskegi ya lay towers gi edo la adalia. Ado ha ishi tegi ya. Ba osalegi kuja stendo nal kuja ni hikeni hinavj ndas egi pesa bando nal no. Ako aja has aja peso hikdes egi office of the controller aja kadaja basala. Na adol kidoshi aja jogot abe has ani hadalia. Na ye laja tasanta ta no the job has ani hadat ego hot hadalia. Beshma has ana hot sad hot dayi lago benacha. Nije baka ilia. So hot aja basalado ishi ajan daidol kid. So hot she pesa aja the dot athot. John in Washington net do pesa jadeta. So only $1,000 gedo shuna na idol kidigi. So ashon da don nia. Doni o peso besli chi da trodan aje da chudo insta no da hot asani hije kundale. Ni masani hiche ni nalapa. Play da don di kon don de kon keda hat inigido. Edo peso da yoket. Do la peso da no da yada kit show. Ashon da arosh kije yada kje. So die ja nasnegi benache kompes ni hije da tao. Ebni na kon la chose ido da shikeroshna. So here barotszen ben here nasnegi do here dan hidi nido da. First, we are going to go to the slides. Eli, first slide there is always an update. I know people are saying, why do you give us an update? Well, this is a town hall. It's for giving everybody an update. And if you don't want to hear this, you have the option of turning off the live feed. But I'm sure many of our Navajo people want to receive these types of updates. Total confirmed cases, 23,841 since the start of the pandemic. The new cases in 24 hours are 110 since Monday, or Sunday, I'm sorry. Sunday to Monday. These are Sunday to Monday's numbers. There's some delay reporting, 3, which had to be reconciled. Total tests completed is 207,074, and those are tests that are multiple tests, and we're trying to, and I've said this many times, trying to break these numbers down to people that have, people now are getting multiple tests. And we need to identify this. And that's also included multiple tests here in this category. The total recovered, 12,211. Total confirmed deaths, 822, with 3 new deaths from Sunday to Monday. So let us continue to lift those family members in prayer. If you go to the next slide, we want to reiterate to everybody out there that is listening that it's really up to us as a nation to push back on the virus, meaning that we have to follow these strict protocols. And if you look at the PowerPoint, the slide here, you can see the progression, the rise in cases. And if you look at way to the far right, January 1st of 2021, you can see it just fluctuates. The reason why it fluctuates is because we do so good, and then we're out the door or we're out in large gatherings again. Social gatherings and family gatherings. And because of the lockdown, this was very helpful to keep the numbers down. But just imagine if we didn't have a lockdown, we would probably be seeing the same spike that we're seeing throughout this country. And it's upon us. It's not upon the government. It's not upon the hospitals, the stores. It's upon us. I mean, we're coming into a new year now, 2021. For the past 2 weeks, and I'll share this with you, and for the past 2 weeks, I've been on funeral meetings in the evening, expressing condolences to people who lost their loved ones. Entire families have been devastated. One in particular, have more than 4 people who have passed in a family. And how do you think leaders feel? Frustrated? Angry? Sad? All those emotions all together. And I ask the Navajo people in this 2021 that there is hope. We have a vaccine, but this virus is going to continue well into 2021. So we got to follow these protocols. We don't have the numbers for the Christmas Day weekend and the New Year's Day weekend. We don't have those numbers. And I pray that it doesn't spike up any higher. So if you go to the next slide there, you can see the increase in cases as we have come from September all the way to December. You got the shelter in place order, which we put back in place. And then you got Thanksgiving. And majority of our Navajo people done well by staying within your immediate household. But as you go into Christmas and New Year's, it's too early to know those numbers. And we'll be seeing those numbers this week for Christmas, and then the next week or two for the New Year's Eve holidays. And if you go to the next slide there, that's the comparison between the U.S. and the Navajo Nation. You could see the brown is the Navajo Nation, and the dark blue is the United States of America. And so we're seeing a progression and a flattening of the curve, but again, we don't see the full holiday numbers here yet. And it's because of those lockdowns and 57-hour curfew. But now that we have federal checks that are coming in, we had stories of mass exodus, mass people leaving the nation to the big box stores, and we're trying to avoid these large gatherings. And that's going to contribute to an uptick, I'm sure. I think Gallup, Walmart was reported in the state of New Mexico as the highest rate of COVID cases for their employees than any other business in the state of New Mexico. Some in Farmington as well. not to scare anybody, but look it up. That's what it shows, and there is a link that we'll share with you that shows that essential businesses, daily cases that are reported to the public. Now, the hope is within the vaccine. I truly believe, because if there's no cure or there's no pushback on the virus, we're just going to have to continue to wear our masks, social distance, and wash our hands, wear a mask, and stay at home. And so when we see the new numbers, and this is just something to compare, and this is through December 31st, the next slide. This is just the COVID-19 vaccination. And this was on a PowerPoint. And this is updated. It's different now. But I just wanted to let you know that Navajo people are wanting to get the vaccination. There's a high demand, I think more so than it is off the nation. And so far, cumulative number of COVID of people initiating vaccination, first dose, 7,748. If you can go to the next slide. And that was as of December 31st. So we've got Pfizer, and you all might have seen us get vaccinated. We got vaccinated with Pfizer last Thursday at Gallup Indian Medical Center, myself and leaders and IHS leadership as well. I consider myself very healthy, plant-based eater, exercise, but the reason why we did it was to bring confidence to the vaccine. And I know people were saying, well, we're not going to take it unless you take it, President. Okay, I took it. I got it in the arm. And I asked, too, that our elders not be afraid, because they're in the most vulnerable population. It's not about jumping ahead of the priority list like some people had mentioned. It's about bringing confidence to the medical profession, scientists. 95% effective of pushing back on COVID-19 once you get your second dose or your second shot. The second shot for me will be done in 15 more days. I think it's about 30 to 40% effective now with the first shot. But once you get your second shot, it jumps to 95% effective. And that's for Moderna as well. So Pfizer, we got 3,900 doses that was first delivered here on the Navajo Nation. And then we got an additional amount because we pushed out Pfizer, and we got most of it all in the arms of our healthcare professionals. So the total amount of Pfizer vaccines that we received for all the service areas here on Navajo, excluding Utah Navajo, because they're going with the state, but we'll get that breakdown. They got doses already, Pfizer doses. So 10,790 Pfizer total doses now. Moderna, these are first shots though, and second shots. I guess they're automatically going to be the same amount coming for the second shots. Matter of fact, our Navajo people that first got their shots at the beginning when Pfizer came that week, this is the week that they're getting their second shot. So now we're getting people that are going to be 95% effective against this virus that are our people or our first responders are. So for Moderna, there's 7,900 doses. So altogether, total allocation is 18,690. And we just barely got some shipments in last week. Some of them came in and ready to go. And so a lot of the 1A, and Dr. Jill Jim will be talking about this in a bit. A lot of the 1A healthcare professionals, doctors, nurses, first responders, police officers, our nursing homes, their staff, and now we're going into the high-risk patients in our communities. And we did start some of the 65 and over, but there's going to be a full focus on 65 and over come Monday, January 11th. And Thursday, we're going to be having all the facility leadership give us, all of us, a presentation on how that's going to be done, how the vaccinations are going to be done. Keep in mind, there's not that much. Right now, total vaccinations as of January 3rd at 9 p.m., 7,749 vaccinations have taken place. Now, the 10,941 that are remaining, that's going to be going into the high risk in our elders and those that are still in the 1A category. So 10,000 is not much. And we're confident that these will be totally used up on the elders. And so we're developing our own track record. We want to complete, just like we did with the first dose of Pfizer and the 3,900, complete those so we can ask for more, so that more can come into the Navajo Nation so others can get the shot. So the priority listing will be shared with you by Dr. Jill Jim, and we're not just making up these priorities. These are recommended by the CDC, and those same protocols are what we're following. So in the 65-year-old and over and the high-risk patients, you know, a lot of groupings will be covered. A lot of people that are in the most vulnerable population will be covered. Medicine people, religious leaders, our veterans that are in the high-risk category, teachers. So it's going to capture a lot of these, if you want to call it, subgroups. And as we move into other priorities, that's when we get additional doses from the federal government. So we wanted to announce that. So really a full-on blitz of vaccination coming January 11th for our elders, 65 and over. So and the last slide is just the Navajo Nation COVID-19 testing schedule. You know, this virus is going to be here. Many of the folks that are in the healthy category, younger age category, based on the CDC criterias and the guidelines, we're looking at maybe March and April for those individuals to get vaccines. But until then, this virus is going to be here. And here are places where you can get a test. You got Navajo Department of Health. You got Kayenta chapter, Tuba City chapter, and this will be on our Facebook. It's on our Facebook page. Some of the chapters: Chinle Service Unit, Crown Point Service, Gallup, Kayenta, Shiprock, Tehatsoi Medical Service Unit, Sage Memorial, Tuba City, Winslow, Utah, Navajo. Please visit our Facebook social media pages. You can download it, get a printout, and share it with your family members. So that's going to conclude our report. Again, Thursday at 10 a.m. Please join us. We'll be going through each of the healthcare facilities in and around the Navajo Nation, Gallup, Winslow, to let you all know how the vaccination for the high-risk patients, a lot of them, the CXRs and the public health nurses are going out and giving them shots out there. But some of our elders or high-risk patients would want to come into the hospital, so that will be available. Two is the 65-year and over. So we'll give you an overview of those on Thursday at 10 a.m. And come January 11th, high risk and 65 years and older. Those that want it, right? Those that want it. Some are not going to want it. Maybe 50%, maybe lower than 50% are going to want it. But as the supplies that we have are available, we will continue to vaccinate those that want the vaccination based on a category that is established by the CDC. So thank you so much. God bless you. God bless our great Navajo Nation. I'm going to turn the time over to our Vice President Lizer. Thank you.
All right. Thank you, Mr. President. We appreciate your updates, appreciate your leadership this morning on January 5th, year 2021. Happy New Year, everybody. Vice President Lizer here. Comanche Nishlan Twalhaned Basis Chin Do Comanche Dashache. It's good to be with you this morning, as we always do, giving you updates, needed information in which you can conduct your daily lives. We do have an esteemed presentation panel here, Dr. Jill Jim, Rosalind So, our own Dr. Perfilia Fowler, and Captain Brian Johnson here to give you needed information. I do not wish to be redundant. I could hearken the same message that our president has just given you. I do wish to continue to advocate for our own Navajo Nation businesses here on Navajo. Obviously, our public health order is one that has not changed. It's actually been extended, and we did advocate for extended hours. As you know, our Navajo Nation residents are all consumers. We all just consume in varying places, and it's our wish, it's our desire from the Office of the President, Vice President, and I'm sure from all leadership here on Navajo that our people are safe. And as you do shop, that only one person goes to these locales, no full capacity vehicles, driving in and about, especially going to the border towns. It's just you mitigate. And that's all we do. Leadership needs to exaggerate the measures in which we lead and go to and fro. And so it's been shown, proven, mask, right, social distancing. These are all things that we're fully knowledgeable. And, we wish that you all would help the nation mitigate the continued spread. So, we have about 73 communities, chapters in our Navajo Nation that have uncontrollable spread right now. The only way is just to clamp down, lock down those that travel. And we have varying degrees of people who do travel, right? Some have to travel because of work. They are essential. But those that, and you all know, it's more of a, a process of being accountable. If you travel, please just one per vehicle to the locales. And at that, we're urging our citizens to stay local, support Navajo-owned businesses, Navajo businesses here on Navajo, as 6% of those tax dollars generated from all of your purchases stays on the nation. Those that do shop locally here in our grocery stores and even our convenience stores, the junk food or those foods with little nutritional value, 2% of that gets raised for, and a portion of that is used for purchase of emergency vehicles and first responder vehicles and equipment. So it's a win-win all around. More people do it. We receive the benefit of it. The impact is felt more greatly. And so it's an economic measure. It's an economic practice that when, again, everybody adopts it and incorporates it and even teaching their children why and the reasons why, that the nation experiences an enhanced level of lifestyle. So again, we're all in this together, and we do fully support our Navajo businesses. We do have our essential ones that are still open for operation 7 a.m. to 7 p.m. daily, Monday through Friday, and we do an hour under 57-hour weekend curfews. And please, those that are traveling, again, one per vehicle, make everybody stay home. Make your children and extended family to stay home. We're seeing a tremendous amount of vehicle travel to the border towns. All of our major corridors are filled with vehicles traveling. We are in the first of the month time. People get their general assistance checks, their retirement checks, Social Security, and again are traveling. That's just the practice. They're traveling, so please be safe. Stay home. And one per vehicle. It needs to be said again because we don't see it happening by and large out there. People are still readily traveling, and we have many of you have received your stimulus funds. We want to be thankful and grateful again for President Trump signing the omnibus bill that was recently signed. Although we didn't agree with the way it was provisioned, we also sent billions of dollars to other countries for various measures. This is the portion that needs to be broken in DC at that level. Pork barrel spending, right? I mean, unneeded spending just for political purposes. That needs to stop. And so we challenge our congressional delegations to work what really needs to be worked at right now. Again, we're appreciative of the stimulus that we did get, but true working for the people needs to be honored. And those that came up with that bill, you got what you wanted, but it came at great cost to the taxpayers of our nation. And again, just wanting to make sure that you all know a lot of things come at great cost. And as you're out there, please take into account, those measures that we're taking. And a lot of it we agree on and we benefit from it, but it came at great cost. So please be careful while you're out there. Those that have received stimulus funds, we urge you as leadership to spend the majority of that here on the Navajo Nation, supporting Navajo-owned businesses and Navajo, non-Navajo businesses that are here on the nation, because we all win. Again, 6% tax goes to the nation and for future development, for future businesses. A lot of aspiring entrepreneurs that are out there. A lot of you see needs right now in this pandemic. It is a health crisis. There is another definition of crisis, and it is opportunity. We have opportunity all around us, merely awaiting our recognition of it. And so as we exit this pandemic and we enter potentially a new pandemic, we're reminded, about a decade ago, we were going through the H1N1 virus that came. As you know, viruses come and go. They change and they morph into something different, and there's different ways of fighting it. And so, again, we're thankful that the President was talking about a vaccine that's out there, the Pfizer vaccine that's readily on our nation now. There's also the Moderna that was out there, and there's much hoopla about, all of these vaccines. how it was made, the technology in which it was made, how fast it was made. Again, it's proven, deemed to be 95% effective now on the second dose of the Pfizer. Be encouraged by that. And, as you contemplate taking it, pray about it, study, show yourself approved, research your own self, become knowledgeable, and become confident in your decisions. And so as our greater society at large, takes this virus, the potential of the spread starts to diminish until it's gone. And now we're not hearing about any flu that's really out there by and large, unless I'm mistaken. So, it's just a new threat, I guess, that's out there. As new threats come and go, some are more, I guess, we're more knowledgeable of because of the attention that the media plays on that. But again, we're all in this together. The majority of you are wearing masks. We do continue to see surging happening all around us, which is why the president and I, continue to urge you to stay locally here. The Phoenix metropolitan area is undergoing extreme spiking, and their numbers are high, as well as Utah and New Mexico. But Phoenix, where the majority of our travelers go, a lot of our family members live down in the valley, where the jobs are, where schools are. Be careful if you have to go. And again, one per vehicle to travel. Again, it's mitigating, it's cutting the risk, and that's all we do. It's all we can advocate for. And exaggerating that measure, it's been said, stay home. If you don't have to go, absolutely don't have to go. Stay home, mitigate and cut our risk here, potentially spreading it to our elders and those that are most vulnerable here on Navajo. So on and on. Again, we could go and then rehash all of these here. Don't wish to be bring in that information that was already shared. As we'll hear more here real shortly, Dr. Jill Jim will be following me here. And I just wanted to bring that, up to you. I would continue to meet and look for opportunities here economically, business-wise. We do have our own Navajo Blue Rhino glove, nitro glove manufacturing facility here, which has been cranking out gloves by the thousands, 100,000s, even the millions right now. But have limited capacity, so we're looking at enhancing that, getting the next project, the phase of that development off, break ground here hopefully real soon, March, and then commence the development of 6 additional lines where we're able to make extra small, medium, large, and extra large nitro gloves, the only nitro gloves that are being manufactured in North America at the present time. So this pandemic is bringing a lot of change, has brought a lot of change. Has also brought a lot of, death to the nation. And being that as it may, we continue to pray, and we'll work like it depends on us, but we'll pray as it, depends on our Creator. And we look forward to healing across the land as we pray daily. In fact, today, tomorrow, Wednesday, we'll be on several national prayer calls calling for prayer eradication in Indian country. We have a lot of tribal leaders that will be calling in to this virtual setting and praying for COVID-19 to be eradicated from our lands. And so, again, those are all behind the scenes stuff, and we'll continue to have those, but also advocating and looking at that business development as we are meeting with the states, local governments, some collaboration with the federal family there in DC, and it looks very promising at this time. Past projects that were once deemed, something the nation wouldn't want to get into, business changes. One thing I understand as a business, as an entrepreneur, is that business does not stay the same. It always changes. There's new opportunities that come. And so what the nation looked at one time in the past perhaps is seen in a better light, and the conditions in which they are done or have changed. And so we're looking at those, and there's some promising opportunities that are out there. We do have land, we do have resources, and we do have a ready and able workforce. It is our commitment per our not a plan, the Neslizer not a plan, that we bring jobs and revenue to the nation, especially in this time where we've lost our NGS, we've lost our key into Peabody Mine. 1,400 jobs were either lost or reprovisioned, and many have left the Navajo Nation to chase jobs. I regularly chime in with workers working in Ohio, Pennsylvania, Florida, Texas, all across the United States, welders, oil pipeline, gas field workers, and on and on. These are workers that we should have here on our own nation. We do have all of these. We just have limited ability. We have too much bureaucracy and red tape. We need to enhance that. And so we're having those discussions. We're looking at creating new policy, changing policy, and on and on. We see lots of opportunity here on Navajo, and we appreciate your prayers for that and to that end. And so I appreciate you all. We're praying for you. We continue to lift up the Navajo Nation and all of our residents across Navajo, that God would see fit to heal our land. And so, again, I could go on and on, but I don't wish to be redundant. So I'd like to bring up next for your knowledge and the updates from our Executive Director of our Navajo Department of Health, Dr. Jill Jim, who has showed and exemplified great leadership during this pandemic. Dr. Jim, I don't know if you've had many days off, but we're praying for you. Continue to stay safe, and you're doing an excellent job. We appreciate your leadership at this time. And so, ladies and gentlemen, Dr. Jill Jim, Navajo Department of Health Executive Director, take it away.
And thank you, Vice President, for all those comments and updates for the Navajo people, and also President Nez as well. So Tehanan, for all your encouraging words to continue to combat the virus here in the Navajo Nation. So say Dr. Dilden in schedule, don the MSNA look on in San Tachini Basis Chindo. Ishe doesn't say dot as a funny doesn't number, although not just on the Aishin or Sado. D. Executive Director A. Commissioner for the Navajo Department of Health, AHE Spahayan to Victims Indo, Daishmut Argi, Taiki non Kivinido. Although President Nez A. Eni Yahaji A. vaccine prioritization that had reached need. So I'll go over those vaccine prioritization in English. So ACA Belagana today, they had that's just so. I just want to encourage everyone to continue to reduce their travel as much as you can while you're here on the Navajo Nation. As it's first of the month, I know it's hard, but we want to continue to keep the numbers down. We have not seen the impact of the New Year's Day celebration, so hopefully everyone celebrated safely at home with their immediate family and reduce as much travel as they could. So today is just some information that we haven't made available, and these are the three different phases that we have. There's phase 1, 2, and 3, but 2 and 3 will be shared later, but that really is just the general population. But for phase A, through the ACIP guidelines, we're looking at healthcare personnel, long-term care facilities as a priority in those category. Next is phase 1B, which is high-risk patients, older patients that are 65 years and older, and also adults in congregate setting. Frontline essential workers, first responders, spiritual leaders include traditional medicine men, roadmen, and also pastors are included as the phase 1B here. And it's really dependent on each health facility's vaccine, what they have in inventory and how far they're down with the phase 1B. So some service units might be distributing differently than others. And then we also have essential infrastructure and essential businesses down the line here. And these are related to how we define our public health executive or emergency orders for the Navajo Nation. And then 1C is other essential workers and the general population. So that's our prioritization here for the Navajo Nation. One of the areas that we do look at is that the Centers for Disease Control and Prevention, they're the ones that provide recommendation to the CDC, or they receive recommendations from the scientific community. They're also named the Advisory Committee on Immunization Practices. This is nothing new. Vaccines are go through this process. And so I guess it's more public than we know, and people are becoming more aware of the process for vaccine prioritizations and recommendations. So as you see here with before December 20th, they had recommended phase A as healthcare personnel and long-term care facility residents. And we believe we followed those guidelines here in the Navajo Nation. For phase 1B is persons 75 years and frontline essential workers. And our population is a little bit more in the 65 years and older. As you know, for the Navajo Nation, more of our elders pass away and have from COVID-19. So there's a high mortality rate for older individuals, and also those that are in and around 75 years old. So those were some changes that did occur. At phase 1C, they were recommending 65 years and older, and then 16 to 64 with high-risk medical conditions. And so these were the recommendations that we used, and we adopted it based on the situation here on Navajo. The disparities of how the disease has impacted our population and the general U.S. population is different. People that live in the urban areas could be different than what we've experienced here in the Navajo Nation. So we definitely did our best in looking at the various at-risk populations here for the Navajo Nation's group. So this is definitely a plus in trying to adopt and modify based on our population. There really isn't a timeline. Of course, the phase 1B and C, as we know, we're all dealing with the vaccine allocations as they come from the federal agency. How much can Pfizer and Moderna produce is something that we really dictates how much vaccines are available and doses are available. So the more doses that we get for the vaccines made available to the Navajo Nation, the more people we can vaccinate. So it really varies, but these are just general guidance that we have for the health facilities. So we will be sharing this on our Navajo Department of Health Facebook page, and also and then also the Navajo Area IHS office is a partner with us in this, as well as the tribal health organizations. All the healthcare facilities are contributing to this and working together and prioritizing what is needed here for the Navajo Nation. So I just wanted to share this information today, and hopefully we'll move forward in getting more vaccines here for the Navajo Nation, and also making sure that we support our elders getting vaccinated. So there will be an elder campaign for most of the health facilities next week, and hopefully they can share some of their plans with us at the next town hall meeting. So I just wanted to share that information today. So President Nez, I'll give it back to you for the next presenter.
We'll go Ms. Rosalind So next. Go ahead, Ms. So.
Thank you. Good morning, everyone. This is Rosalind So. I'm the Area Director for the Navajo Area Indian Health Service. Again, thank you for joining us for information regarding COVID-19, as well as other updates. I also want to take a moment here to wish everyone the best in 2021, and I know that 2020 was a challenge, and we certainly will remember that. But we do have hope and looking forward to what 2021 will bring for us. With respect to Dr. Jim's presentation, again, we know that there's a lot of questions out there regarding the vaccine, and we want to follow the information that was just provided. That's what Indian Health Service is continuing to do out here. In addition to that, we wanted to also share that as a result of the rollout with the Navajo Nation, we did get extra vaccine, and so we're working through that to make sure that we continue to get more, but use what we have according to the guidance that was just provided. I also wanted to provide just a couple other updates from the Indian Health Service side. Many of you have probably been listening to the news with regards to they call it the coronavirus that was just signed by President Trump on the 27th of December that brought to Indian Health Service an additional $1 million to IHS. And so this is significant in terms of how we can continue to fight the virus. But also as an overall, we are looking at an increase for the IHS budget of about we're looking at an increase for Indian Health Service budget overall about $189 million above the 2020 enacted budget. And so this is significant in terms of the improvements that we want to make through all of Indian country. We know it's not enough, but it's certainly positive that we get positive numbers there. And part of the increase includes $26.5 million for electronic health record. Again, we're finding through through this pandemic that the health record systems are very important. So we will be coordinating how that will be distributed throughout Indian country for everyone. There's also an increase for 105L leases. This is again for the separate indefinite appropriations, similar to the contract support costs. If you're following any of the budget activities, so this is a good thing for us, which means that these costs don't come out of the appropriated funds. There'll be a separate funding for that. In addition to that, there were a little bit of the increases for the community health representatives. We're also finding through this pandemic how critical our CHRs are to our healthcare system. And many of the tribes have already contracted or compacted their CHR programs. So much of these funds will be going over to the tribes. Health education also had a small increase, and so does the healthcare facility construction funds. And so this again, as we're maneuvering through this pandemic, our facilities, our infrastructures are critical to how we're how we need to operate moving forward. Also on a good note, and this was also already announced by the President's Office, the Special Diabetes Program for Indians was reauthorized for $150 million through 2023. This again is a very, very important program, particularly to the Navajo communities in the Navajo Nation. And on top of that, Indian Health Service also received, as part of their budget, about $1 million for us to continue to fight the coronavirus. And so this is very important. And so there was a tribal consultation that was held yesterday. This was a rapid tribal consultation to make sure that we get information out there, as well as making sure that we are meeting the needs of the Indian tribes that we serve. $210 million will be related to vaccine-related costs. This will be available through 2024, and $790 million was identified for testing and related costs, again, through 2022. So these are significant amounts of money. I listened to part of the consultation yesterday, and it is still open for tribal consultation comments, but we're wanting to make sure that we get these funds out to Indian tribes and to Indian Health Service facilities as soon as possible. So that is the funding information that we have. available, and that's coming down through the Indian Health Service funding appropriations. In addition to that, I wanted to share that we continue to look for ways that we're maximizing the care that we're providing at our hospitals. And as such, we have now agreements with the Veteran Administration for transfer of patients that we might not be able to treat in our hospitals because they need higher level of care. We currently have agreements with the state of Arizona out of Tucson and the Phoenix VA. We have agreement with the Albuquerque Veterans Administration, and we have agreements with Colorado facility as well, and the Salt Lake City Veterans Administration. So what this does, it allows our hospitals to transfer patients out, which is good for us to be able to manage the patients that we have in our facilities. And lastly, I wanted to share that we still have Department of Defense medical teams that are on the ground. Again, this is the first of its type in Navajo country, and so we're glad, and this has been a welcome visit that we have from these team members, these medical teams, that not only do they support our current medical infrastructure, but they're also supporting our hospital staff and give them a little break as needed, and also allows us to focus on the vaccine a little bit more while we have a little bit of extra help. So right now we have teams at Shiprock, Chinle, Tuba City, and the Gallup Indian Medical Center. And so we are also looking for additional, to extend them to allow us to have more assistance and more help on the ground as we manage through the pandemic. So I want to thank you again for your time. Thank you for listening to us and following the guidance that we are trying to provide. We are working very hard to get the vaccine out to all of the locations, and we will continue to do that in the manner that was just described earlier. So I appreciate your help with us. I appreciate all the questions that we're getting and the interest that we're getting. Again, we encourage that we focus right now on our elders and our patients that have underlying health conditions. If you can help us manage that, as we are also scheduling those as necessary, so we don't have people waiting in long lines. We appreciate your help on that. So with that, I'm going to turn it over to Captain Brian Johnson for any additional updates. Thank you.
Good morning, everyone. This is Captain Brian Johnson, serving as the Acting Deputy Area Director for the Navajo Area Indian Health Service. Thank you, Ms. So, for the report on those items. And I just have a couple of things to add on. And of course, we know that these days the vaccines are of great importance to everyone. And so I want to thank Dr. Jim and President Nez for sharing the information this morning on the vaccine prioritization. It's very important that everyone understand that there is a prioritization process that we must go through, and I know that it will take time, but definitely folks will be getting the vaccine they need. I just wanted to back up just for a moment and also just reiterate that at this point in time, nationally, there are 2 vaccines that have received emergency use authorization. And we've heard the comments about Pfizer and Moderna, and those are the 2 that have received such designation for use. And so those vaccines, again, have been approved for use and for emergency use. And we've received and have distributed those. And so those are the 2 vaccines that are being utilized at the various federal and tribal service units here on the Navajo Nation. And as Ms. So indicated, we do anticipate that additional shipments will be coming in. And we'll try to share that information on these town hall events as well as through other venues as we are able to do that, as more vaccine does come in here to the Navajo Nation. I also just wanted to really, mention that again, I've already stated that we realize that everyone is interested from all age groups and all health statuses. And it's, we realize and we're working diligently, planning and coordinating across the healthcare system here on Navajo Nation. So again, last town hall, I had mentioned that we're very fortunate because we do have a unified healthcare system during this pandemic here on the Navajo Nation. So we do know that there is communication that's going on between all of the federal locations as well as all the tribal locations, including the Navajo Nation. And it's different if you can imagine living in a larger city where there's 20, 30, 40 different healthcare facilities that may not communicate for at least directly for their communities. Whereas here on the Navajo Nation, that communication is taking place. So whether you're from Tuba City service area or Crown Point on the eastern side or Gallup or Northern Navajo, etc., there's communications amongst the leadership, there's communications amongst the clinical folks, and with their incident command, just making sure that we're all on the same page in terms of the direction that we're headed. So I want to thank everyone out there for that. But again, this is a critical time. I feel like this is perhaps one of the most critical times in this pandemic, in that prior to this, we did not have the vaccine. And so there were various messages going out, public health messaging, that did not include vaccines because we didn't have access to those. Well, now we are getting access. We do have access, and we will continue to have access to vaccines, but it is going to take time, and we're going to need everyone's patience as we work through this. The prioritization and the priority groups are being worked through, and everyone's trying diligently to get to all of our patients that we can in an orderly fashion. So again, we'll just need to exercise patience at all levels as we work through this. And so it becomes important at this point that we continue to wear our masks, to watch our distances, and to wash our hands. So nothing has changed in that way. We all need to continue focusing on those three, and we need to be sharing that information, continue to share that with friends and family members, is making sure we're doing the 3 W's of wearing our mask, watching our distance, and washing our hands. And what's a little bit more different right now as opposed to earlier in the pandemic is that we're, of course, in the middle of winter time. And in the winter months, of course, it's much colder outside. The temperatures dip down, and it becomes a little more challenging in terms of maybe not being outdoors as much as we were previously during this pandemic. Not going on the extremely long walks or not being outside. We're more indoors at this point. And that does a couple of things. That actually more and more individuals inside can cause the disease or allow the disease to spread a little easier whenever we're indoors together. But then just as important, people start feeling the pandemic or COVID fatigue, meaning it's been a long pandemic. We're many months in. And during the winter months, when you're not able to go outdoors as much, and you're not as able to be in some cases as active as you would like to be, then it can cause us to get tired, to help us feel fatigued, which is not a good thing, because then we might start getting a little more careless about protecting ourselves. So I just wanted to send a message of urging everyone and encouraging everyone. I know it's been a long pandemic. I know that it's very trying on our families, on our friends, and our loved ones. But just hang in there. The time is drawing near when the vaccinations will be provided throughout Navajo, and and we'll be in a much better place at that point. So there is hope on the horizon. And we just appreciate everybody working with us on that. I also encourage everyone to be sure that you're listening to the radio, that you're checking on the internet for scheduling, any types of vaccination scheduling amongst your various service areas. It's going to be important to not only for yourself to get that information, but also to share that with your family and friends. And for those, for example, if you have access to the internet and are able to check on the scheduling that may be posted, and if you're hearing things on the radio, be sure to share that with others who may have missed it, whether they're your friends, family members, etc. And with that, I just want to say thank you again across the healthcare system. Thank the Navajo Nation, both the president and vice president and the council delegates for the leadership, and Dr. Jim as well. And also looking to our healthcare facilities, both tribal and federal, just with the outstanding work that's been done. I know that many folks don't have may not be able to see all the work that's been done across the Navajo area, but it's quite amazing in terms of the healthcare team coming together. And no system is perfect, but there has been a lot of great things done. So we just appreciate everyone out there, from the chief executive officers to those who are working the front lines, to the administrators. We appreciate your work. And with that said, I think I'll turn the time over to Dr. Fowler, I believe is next in the lineup. And thank you, everyone.
Thank you, Captain. Thank you very much for all your services that you're providing for our people. My name is Perfilia Fowler. I'm the Division Director of Human Resources. I want to thank everybody for listening, tuning in to our town hall. Happy New Year to each and every one of you. I know that we all did not know that this pandemic will last this long, but we were all overcome it together. I want to thank each and every one of you that are abiding by our executive orders that are in place, our curfews that are in place. Our executive order does end Sunday. As far as any extension, that is not determined yet until we look at our numbers and listen to our healthcare providers. Ihe hidini do les not ahanosini do ihe nihenada hedo nastit nadi ke akohashino sati nihibehas ani hata the nebik ahanos any ihe do hashino sai ati do bikit o tihi do zagi ahabikishti tihi do kadenes non disease ahawadisotan hit niniki ado hashin toti the kwasnasnihiki Doiton donasnihiki ati konasni eben nachabe ta akhlian hiti na akhuiche nihila khata kis nihichiton hizepe ni betata espal nihitana chiko innocent dan hiti nine ati ata benta ni tien ado hashino sae ati hinda ka edo asana wasetan hitna. But we want you to continue to taking preventative measures. The virus is still around. And we want you to continue wearing your mask. Just a couple of weeks ago, I doubled up on my mask. For me to feel safe, I had to double my mask. Continue practicing social distancing, continue washing your hands, avoid social gathering. We know some of you are still doing gathering. The virus is still around. It's a serious matter. We did talk a little bit about the vaccine. We have Pfizer vaccine and then also Moderna. And there's a total of 18,690 vaccine that we had received and our people have been vaccinated. Is that nihichakul ya adodi is el embesnahas ano e ad atse Akodi as igi sape hakan kai kwa be ha da it's edinal sosi el ketjon the doba as de tell ya to shikedo shitne ado o was the o aquas el wata na sos hanatas del ino hashin so na hot ikhe aka ni hashin sakoti kashketa bel hunasi sado ya at hotel on bandi ne wina sinchik edo shitna etsuda ashkonda banan hyoshkan sado ya at ni ndiltiki ado kuj sabe in do de ado beshba na be na holne an be et na yilna hot anda antina keda. We have many people that are frustrated. We have leaders that are frustrated. You as an individual may be frustrated, but it's not a good idea or it's not best practice to share your frustration or send an email or make phone calls out of frustration. Your language, the way you say it may be misinterpreted. So that's why we're telling you, hold off on your negativity. The negativity builds on yourself and it reflects who you are, reflects your family, your mother, your upbringing, everything. So if you're going to complain, if you have more complaints, share your solutions. I always tell people, if you have a complaint, a concern, a lot of you have concerns, but share some solutions. And then we tell people, we say to each other, oh, things are expensive here on the Navajo Nation. That's why we go into town. But in reality, do your math. If you say things are expensive here at Bashas, you go into town, you're going to eat there and look at the cost of it to go there and back. And the same thing, you're putting more money into going out there than saving here. But there's some of us that do that. You gotta think ahead. Think of how your post, your response be received. Please be very careful. Our elders used to teach us so much about life, about how we carry ourselves. Be very careful because there are people out there that could misinterpret. So those are some of the things you have to be careful with. Our purchases. We're into the new year, ladies and gentlemen. Ishi nan kines trai ben nache hota adilni or chon le hon de nan kisi kes niki honesh kis pansen that they kes niki kaya pansen that they kes ke that il yeh niki na loshi net aj and that si kes adon ka achin da ultra aj den sen dan kisi kes so hey ba ultra la hota ba ultra ba da ultra la. The pandemic has taught us so much about our home. We thought of our homes. We thought of our fire pokers, our land, our farm plots, a lot of things that we were avoiding. It took a pandemic to make us think back of our homes and our upbringing. A lot of the children that have gone to school as a parent, we became the educators at home. We realize what educators go through because we're now experiencing that. And there's some of us that still do not have the proper broadband within our homes and come up with some solutions. As an employee, not only as a Navajo Nation employee, but overall, when you're an employee, it starts with you. There are so many things that we need to improve on. It had to take a pandemic to let us realize all the things that needs to be improved within our government, within our home, with everywhere. There's so many things that needs to be improved. And look at it this way. It's not all negative, my people. These changes we need to make. Some of these changes are going to become permanent for the better for our people and then for our nation. I always talked about last year, I'm talking about going paperless. Look at, it's a pandemic. We got to do everything online. Take a couple click of a buttons to get things approved rather than waiting and telling our customers to come back tomorrow. Enough of that stuff. It's time to make these good changes, to make permanent changes for our people. And not only government, our home is the same thing. A lot of planning needs to happen. So we want to thank everybody for listening. We want to thank all the healthcare providers, all the frontline people, our police officers, law enforcement, our military personnel. We have some military personnel that are assisting at various hospitals. We want to thank the individuals that released the vaccine. There's more coming, more vaccines. Again, it's voluntary. Is nisha ato katnoson nisha kedoshin Oko kodoshin so ananish la dole oshi yugo nihil bahasdo nan de Joan eat to ila kanzal oishne tado nini hito the home what the so dani has open not skin. So hey, it's a qua as Hazni Ajanshi is the Nahalianda Kahala o con with Katilier Nahota Nahot Igel is the Kahal Ido E Ahon the Nazi staff or she your class the Shahan Yajins of that you go and kiss the dollar Edo Nahuinos and Dole Juna and Tinita. The last part is just because you got vaccinated the first round does not mean you get to go wherever you want. You still got to take the extra precautionary measures according to our healthcare profession and our CDC guidelines. So please take care of yourself. Let's start off this new year with a lot of good changes, good improvements is what we're looking for. Again, thank you for tuning in. Thank you for listening. And please have a safe week and a blessed week. Na ake hashikedo shidna kon sagoshin nihil chitinada hosita do lashikedo shidna na ake hadota ata hofia